Hundreds of people remain stuck in hospital emergency departments waiting for psychiatric inpatient beds.
5 Investigates first exposed this problem earlier this year. Our Mike Baudette tonight has new details on where this crisis stands now and an update on the search for solutions.
The pandemic's toll on mental health is lingering, and it's especially tough on children. On Beacon Hill, both the House and the Senate have passed bills that would help, but now the two branches must reach a compromise before the legislative session ends in just a few weeks.
My husband and I have been going through a lot of difficulty with our kids since my son was about 3, my daughter was about 9 years old. So it's been 15 plus years.
15 plus years of struggling for Kate Maffa, who's watched her 2 children suffer through mental health issues.
We have between 25 and 30 psychiatric hospitalizations. So that means each time going through the ER, waiting for a bed.
The problem is known as emergency department or ED boarding, where people in hospital emergency rooms are waiting for psychiatric inpatient beds. It was an issue impacting people of all ages before the pandemic, but now it's an even bigger problem that's especially tough for children. How long were the waits that you experienced?
10 years ago, the waits were 1 to 2, maybe 3 days. Now it's much, much worse. It's much longer.
The Massachusetts Health and Hospital Association tracks the numbers. 247 children were waiting in emergency departments at the end of March. That number has gone up and down over the past few months, dipping to 85 last week. But it's a persistent problem.
This is a behavioral health crisis.
Lee Simons-Yeomans is Senior Director of Healthcare Policy at the Massachusetts Health and Hospital Association. If the numbers go down, that doesn't necessarily mean the problem is getting better?
That's correct. I think a lot of the fluctuations we've seen are the typical seasonal fluctuations.
Simons-Yeomans says she expects the numbers to rise again in September when kids return to school.
Behavioral health needs of the general population have just increased significantly. That volume has increased. And it's also been difficult for people to access care because of that volume and because of workforce challenges.
On Beacon Hill last year, the Senate passed the Mental Health ABC Act 2.0, aimed at addressing barriers to care. And the House passed its own version last month. Both versions would create an online portal to help find open beds. But there are differences that need to be worked out by a conference committee before the end of the legislative session on July 31st.
Whatever bill ends up being conferenced will have huge benefits to the behavioral health system.
As the clock ticks, Kate Maffa, who runs a support group for parents with children with psychiatric issues, says something must be done.
These parents are desperate for help, but everyone that's in this group knows that the system is completely locked down, that there isn't help available.
A behavioral health trust fund that includes nearly $200 million to address the mental health crisis is now out of legislative limbo on Beacon Hill. But the money won't be spent until the Trust Fund Commission meets and makes recommendations. Bottom line, there are no quick fixes to this mental health crisis. Mike Baudette, 5 Investigates.